Hi there.
Hi,
Hi, my name is Vince.
I'm Yuva Christian.
Hi, Mr. Christian. Nice to meet you.
Nice to meet you.
Would you prefer Uber or Mr. Christian?
Yuva's good.
Uber is fine. Yeah. All right. Well, Uber, the purpose of the interview today is for me to get to know you a little bit better and just to check out your occupations, your roles, and environment. Before we get started, have you seen an occupational therapist before?
No, I haven't actually.
All right. Would you like me to tell you a little bit about what we do?
Yes, please.
Okay, so we work with people of all demographics, of all age groups, and we look at occupation. So when I mean occupation, I don't mean like just a job. It could be anything that entails in your daily activities, so such as driving, um, working, or even like stuff like self-care. So we'll see if our clients need help in achieving those tasks, and when we do, we most likely want them to attain their goals. So, for example, if you want to drive, but for some reason you can't, maybe because you have something like arthritis or something, we help you to achieve that goal. If so, most independently as possible. So that's kind of like a little bit, a snippet about what we do. Is that a little bit clearer?
Yeah, that's great. Thanks.
Okay. Um, yeah, so again, this interview is going to be divided into three parts:
Sure.
occupations, roles, and environment. So, occupations, like I said, is a bunch of daily activities that you do as a function of your daily life. Um, Environments will be your work environment, your home environment, basically your surroundings.
Right, sure.
Roles is kind of what you identify yourself with, which is if you're a student, if you're a son, or things that you can, like identifications that you can relate to. So just to let me have a better understanding of where you're standing right
Right, definitely.
now. All right?
That's right.
Okay. So you have any questions for me so far?
No, so far.
All right. Okay. Let's get started then. Okay. Before I go into those three sections I talked about, I also want to get to know you a little bit better. So can you tell me a little bit about yourself, your background, if you're currently working or studying?
Yeah, sure. So, I'm originally from New Zealand. I came here to study medicine. So I'm studying at the moment.
Okay.
I'm 21 years old. Yep. Got two older brothers. I worked in an airport before.
Okay.
Yeah. But yeah, currently full-time studying.
Oh, okay. All right. So
anything else?
full-time studying. Okay. So can you give me an example of what a typical day, let's say a work day. So like I know for students, it's sometimes it's not just the weekends and weekdays. So for every day. So give me an example of your typical working day.
So around approximately 8 o'clock, I have to wake up to go to class. I have classes throughout the day. I work in labs as well. So so from 8 to 3 o'clock, I'm in classes.
Oh wow, 8 to 3.
Yeah, 8 to 3. And then from about 4 to 6, I'm in the lab doing research work, which I do. Then I come home. I try to go to the gym.
Okay.
And then I try to study as well. And so after I can come back from it. So it's a pretty full-on day.
So it sounds to me like there's involving a lot of studying and working, and a little bit of gymming in between as well, right?
Try to keep fit.
Okay. And what would be an example of a weekend? So let's say more of a relaxing day.
Yeah. Definitely on Friday, end of Friday and Saturdays. I will not do too much work.
Okay.
I still go to the gym though to keep healthy.
Right.
Try to involve some study, but usually just going on the computer, going out.
Going out,
Going out.
Alright.
Having a few drinks.
Yeah. So you're pretty active on your weekends.
Yeah, pretty active. Still active on the weekends.
Still active.
Yeah.
That's great. All right. Okay. So let's now get to a little bit more specifics because I want to know more about your occupations, aka activities. So self-care. When I say self-care, I'm talking about things that you do to, like for personal hygiene. Let's say like brushing your teeth, showering, putting on clothes, doing those type of things. Is there any of these activities that you find particularly challenging to you or you do?
No, I'm actually like daily hygiene and activities I find perfectly normal. I can do everything normally. Yeah.
You can do everything normally.
Yeah.
Yeah. Can you Can you describe, like, do you think that you find yourself very efficient at these daily basic care activities, or do you find yourself sometimes struggling, or?
Yeah, fairly efficient. I always brush my teeth 2 times a day. I always take showers 2 times a day. You know, but sometimes I do feel lazy, so
Oh, okay.
you know,
Alright.
showering
Yeah.
1 time. But I always take a shower.
Yeah,
definitely.
for sure.
Yeah, just pretty efficient. I always try to do it, and you know,
Yeah, just to keep yourself, you know, well groomed and
definitely.
well hygiene, free from all that.
Yeah.
All right. So how challenging would you rate these tasks for self-care if I give you a scale from 1 to 10, and 10 being the most challenging, 1 being not challenging at all?
Definitely 1.
Definitely 1. All right, you're in pretty good shape.
Pretty good shape. Yeah.
All right. And how would you rate your self-care performance? By performance, I mean, like, are you efficient, and how well do you think you accomplish those tasks?
And scale 1 to 10.
1 to 10, and then 10 being that you're really efficient, 1 being you're not very good at it.
Probably in 9, because there are some days that I, just can't be bothered. And just go to
absolutely.
bed.
But overall, not too big of a problem. All right, sounds good. And now I'm gonna move on to your work.
Yep, sure.
So, let's talk about your work, because you mentioned that you study a lot as well as you do research.
Yeah.
So can you tell me a little about what that entails?
The research or the studying?
Both, right?
Yeah, studies. I study aspects of medicine at the moment.
Okay.
So it's quite intense. I have laboratories, I have tutorials and things. So I have to go to them, and it's a lot of work that's entailed, but nothing too strenuous. However, my lab research, I have to go to the clinics in the RPA hospital, in which I see patients. So I have to communicate with them. Sometimes the wards are far away from each other, so I do get pretty tired after a long day.
Okay, so you're saying from transferring from patient to patient, you kind of
after they're on different wards, so like the 8th floor, the 1st floor.
Oh wow!
So
no elevator, right?
I could use the elevator, but I still try to keep healthy. I don't really like using the elevator, especially when it's designated for patients and things. So
So how do you find talking to the patients? Are you comfortable with talking to the patients, or?
Well, for most of the time, yes. Sometimes we have some patients that you can't really communicate with.
Right.
So I struggle in talking to them, but I try my best.
Right. So how do you find the overall experience in your research, as well as your studying?
It's hard. It's definitely hard. There's a lot of work. I don't have much spare time during the weekdays to do anything. I just go to the gym and study, and that's pretty much it. So it's definitely hard to do, but it's rewarding.
It's rewarding.
But it does take a bit of a toll on my body. I can feel that I get more fatigue easily.
Because you're always concentrating a lot, or?
Yeah, I was concentrating, always working, always have like things on my mind. Like,
like multitasking. Yeah. So, can you tell me about how it's rewarding for you?
Oh yeah, I'm learning about orthopedic surgery actually, which is something that I want to do in the future. After I finish my medical degree, so it's rewarding in the aspects that I know what I'm going to be doing in the future, and that I have the prior knowledge in it, and it's like interacting with patients that have those orthopedic injuries. This really gives me indication that I love what I'm doing. So yeah, definitely.
That's great.
It gives me a good insight into it.
It's always great to know that what you're doing right now is what you like.
Yeah.
So you want to specialize in orthopedics in the future. Great, that's awesome. All right, okay. Kind of asked you a lot of these questions, but I guess what's the most enjoyable thing about your work, and what's the least enjoyable thing about your work?
Okay, the most enjoyable thing is definitely interacting with patients, because it feels like I'm actually not just studying. I feel like I'm actually in the workforce, getting real experience, and instead of just paper and pen work. Yeah, and at least it's just like doing classes that I've already done, because I've done them back in New Zealand, and I have to do them here because some interchangeable things.
So it's like kind of double the time.
But what I have to do this is just I don't really pay much attention to it, and it makes me more tired because sitting down and doing work, and I get bored.
Right. What's the most challenging that you find at your work?
Most challenging? is I did say this before, is interacting with patients that can't communicate properly, like
Okay.
language barriers.
Absolutely.